Hello friends, welcome back to Complete Medical Coding. Today let's discuss the topic which is about Medicare global periods. Okay, this is something like which falls under Medicare guidelines. Okay, Medicare global periods. So before that you need to know who is Medicare, what are the rules or what are the guidelines that falls under Medicare. All these things you need to know. Okay. Friends, if you are new to the channel, please support me by subscribing to the channel. So let's watch out the video. Let's watch out the slides one by one. Okay. So Medicare global periods. What is Medicare? Who is the Medicare? Who is Medicare? Since we are following CPC certification under AAPC, okay, you need to learn about the Medicare, Medicaid, all those private and workers' compensation, all those, everything you need to learn. So, yeah, who is Medicare? It's a federal program, okay. Medicare is a federal program for people who are older, like 65 years of age or older, okay. So, Medicare is a federal government program for people aged 65 years or older. All right. So, apart from that, people younger than 65 with certain disabilities, those who are younger than 65 with some disabilities or permanent kidney failure or amyotrophic lateral sclerosis, it's also known as ALS, amyotrophic lateral sclerosis. Okay, these people are also eligible for Medicare. I will take a separate video regarding Medicare, Medicaid and everything. So this is what Medicare is basically. Usually it's a federal health insurance program for people aged 65 years or older. Okay. So that is Medicare. Now we have to learn what is global periods. What is global period in medical billing? What do you mean by global period? So before going to learn what is the global period in Medicare, you have to know what basically is global period means. Okay. So what is global period? A global period is a period of time starting with a surgical procedure and ending some period of time after the procedure. So global period is a period of time starting with a surgical procedure. So whenever a surgery has been started, whenever a surgery is started, that starting time and then some period of time after the procedure. So that time period is called as a global period. Okay. Many surgeries have a follow-up period during which charges for normal post-operative care are bundled into the global surgery fee. So many surgeries, most of the surgeries are having post-operative follow-ups, right? Post-operative follow-up period for most of the surgeries. So that follow-up period will be bundled along with the surgery fee. Some post-operative care, normal post-operative care are bundled into the global surgery fee. Like for example, you can say even the delivery, cesarean delivery, sometimes after the delivery, immediately after 1 or 2 days, the follow-up time is there, right? Post-operative period. That is already bundled along with the cesarean, along with the procedure. So that is also, that is a bundled procedure. So all this type of period are called as global period. Okay. So that is what global period is. Now you have to know what is Medicare global period. You need to know. Let's discuss what is Medicare global period. This is something which is important. Okay. So what is Medicare global period? Medicare defines the global period as that period of time during which a physician may not bill for related office visits. It's same like global period. like the follow-up visits are not billed by the physician. For some related office visits, some related procedure, some related office visits for a particular procedure, the physician will not bill the MEDICARE. So that time period is called as the global period. Okay. So MEDICARE defines the global period as that period of time during which a physician may not bill for the related office visits. Alright. Now, the global period is usually of 3 types. It could be 0 days, it could be 10 days, or it could be 90 days. 0 days, 10 days, or 90 days. The global period usually falls like, say, either 0 days means there is no global period. 10 days, we can't say there is no global period of 0 days, like that. Okay. Then 10 days, global period of 10 days means the follow-up period of 10 days or 90 days. So when will this 10 days and 90 days follow up? 0 days, it's understood that some procedures will be carried out on the same day and same day discharge and no need of any follow-ups. Some minor procedures, that is 0 global period. What about 10 days global period? 0 or 10 days, both. It falls under minor category. So 10 days global period falls under minor surgery, small surgery, okay, minor surgery. And then for major surgery, the global major surgery represents the global period of 90 days. Okay, so like that the global period is categorized: 0 days, 10 days, or 90 days. Okay, so this is a table that shows global period definitions for major versus minor surgeries. This is just for your understanding. Okay, like major surgeries, the decision for surgery, major, what if it is a major surgery and what if it is a minor surgery. For major surgery, post-operative period is 90 days, as I told you earlier, and minor surgery, post-operative period is 0, either 0 or 10 days. Then for major surgery, examination day prior or same day. The examination day could be 1 day before, 1 or 2 days, like prior or the same day. Minor, for minor surgery, examination will be on the same day. There is no prior. Okay. Then 57 modifier is used for major surgeries and 25 modifier is used for minor surgeries. Then decision for surgery is a major procedure. That falls under major surgery. And then minor, significant separately identifiable E&M service. It's an E&M service only, minor surgery, but like it will be done on the same day itself, right? Minor surgery. Or either it could be done in the office visit itself, or otherwise on the same day itself. So that will be the minor surgery. Table 2. Global periods for retina procedures. This is also for your understanding purpose. Just I have taken only for the retina procedure, what are the global periods. Okay. Some examples. Alright. 67108. That means repair of retinal detachment with vitrectomy. Vitrectomy, the removal of vitreous humor. That is vitrectomy. So that falls under global MEDICARE global period of 90 days. Repair of retinal detachment with vitrectomy. So MEDICARE global period of 90 days, which means whatever procedure that is related to this vitrectomy procedure, whatever follow-up visits which is related to this vitrectomy procedure, it could not be built within this 90 days period. Okay, that is what it means. It is already billed in the major surgery itself. That is bundled. Now 67105. Repair of retinal detachment, photocoagulation. So retinal detachment repair by photocoagulation method, that is a MEDICARE global period of only 10 days. But if it is vitrectomy procedure, it is 90 days global period. 67210. Destruction of localized lesion of retina, 1 or more sessions photocoagulation. Again, it's a major surgery, 90 days. 67228. Treatment of extensive or progressive retinopathy photocoagulation. Again, 10 days. 67028. Intravitreal injection, that is 0 days. Yeah, these are the small procedures that falls under global period of 0 days. Okay, intravitreal injection, something like that. So these are just for your understanding. By reading out all these like CPT codes or the description along with the global period, you will understand, right, what exactly is meaning of Medicare global period. All right. And then now this is another table that shows global days, also called as globe days. Pre-operative, what are the pre-operative global days and post-operative global days? Okay. So global days, what are the global days? What are the global periods? 0, 10 and 90. That is what is mentioned initially on the first column. 0, 10 and 90. For 0 global period, the pre-operative global days is 0. And post-operative global days is also 0. It means it is done on the same day. Minor surgery. Now, global period of 10 days. It means pre-operative global days is 0. There is no pre-operative global days. Like there is no prior examination, as I mentioned earlier. And then post-operative global days is 10 days. Now 90. Now for 90 global period, 90 days global period, it means pre-operative global days is 1 day and post-operative global days is 90 days. Okay. Then Y represents, alphabet represents, global rules do not apply. If there is any Y, it means global rules do not apply. There is no global period rules applied. Z represents add-on code where global period is assigned through the primary code. Add-on code where the global period is assigned through the primary code. That is what ZZZ means. Okay. So friends, that's all about Medicare global periods. Hope you understood. This is a very simple topic. Hope everybody understood. If you have any doubts, please mention and please mark it in the comments. And I'll get back to you soon. Okay. So in the next episode, I'll be coming back tomorrow. I am coming back with the practice questions, the remaining practice questions from the previous video. So thank you so much, friends. Thank you so much for all your support. And those who are new to the channel, please subscribe. And if you like this video, please like and share it among all of your friends. Okay. So stay tuned, friends. Thank you so much. Bye. Take care.